G'day, and welcome to this vodcast on removing a chest drain. My name is Darren, and I'm the clinical nurse teacher on the thoracic ward. This vodcast should be used in conjunction with Metro North's online chest drain learning package, which also examines the reason for chest drain insertion and the nursing management of a patient with a chest drain in. By the end of this session, you should be able to identify the equipment required for chest drain removal, describe the steps involved in removing a chest drain, list the post-drain removal care of the patient, and name 3 complications of chest drain removal. Before you remove the chest drain, there's a few things that you need to check. Firstly, you need to check that you have a documented medical request for the drain's removal. Check the amount of drainage in the drainage chamber. Check if the chamber is to be sent to pathology for testing. And lastly, check that suction has been removed from the drainage circuit. On the thoracic ward, we use a 2-person technique to remove chest drains. As the person removing the drain, you will be responsible for communicating with your patient as well as your assistant. The assistant's role is important in supporting your role and is responsible for the post-removal dressing of the drain insertion site. You'll need the following equipment for a chest drain removal. You'll need remove wipes to remove the old dressing. You'll need a blue undersheet. You'll need a dressing trolley with a clinical waste bag attached. You'll need a dressing pack with extra gauze. You'll need sterile gloves for both you and your assistant. You'll need normal saline to clean the wound entry site. You'll need a suture cutter. You'll need stereo strips for closure of the wound. And then you'll need a dressing to go over the insertion site. We would usually use a small post-op site. When discussing the removal of your patient's chest drain, you'll need to review with them the process for removal, the position you want them to be in for the removal, the breathing technique that you want them to use. Chest drains should be removed with full lung expansion to reduce the amount of residual air in the chest cavity and to prevent pneumothorax from reoccurring. And you'll need to discuss if they have any pain relief needs. Your patients will want to know how much pain they will have and how long it will last. So let's watch one in real time. Hi Scott, my name's Darren, and this is Kim, my assistant.
Thanks, Scott.
We have spoken with your doctors and they've asked us to come and take out your chest drain if that's okay.
Okay.
So there's a couple of things I need to explain with you before we actually go through the procedure. Obviously you've got your drain in place, there's a dressing over the top. The process for it to come out is we take that dressing down, we clean it with some normal saline. There's a little suture that's in place there. We would cut the suture, then we'll go through a breathing technique. I'll get you to take a deep breath in, hold it, and we'll take the tube out. Okay. The breathing technique that we use is one where we'll ask you to take a deep breath in, breathe out, breathe in, breathe out. Take a deep breath in and hold it, and that's when we'll take the tube out. Okay, but we'll practice that a little bit closer to the time. We always take tubes out in pairs, so when I take the tube out, I'll actually be pinching your skin, and Kim, who's my assistant, will actually put a stereo strip in the dressing over the top. Okay. Now most people say that when we're taking the drain out and pinching, that's what causes most of the pain because I'm actually pinching your skin. But what that does is it helps us to prevent air from going back into that lung cavity. Okay. But again, once the stereo strips are on, the dressing's over the top, my fingers will come off, and everything should feel okay.
Okay.
Any questions so far?
No.
No? Okay. So I'll explain more about the procedure as we go through, if that's okay.
Yep.
Okay, thank you. Now I understand the girls gave you some endone about half an hour ago, is that correct?
Yes.
Okay. Do you feel like you need anything more for pain at the moment?
Not at the moment, no.
No? Okay. I might get you to roll onto your side for me. I've got a bluey here, and we shall pop the bluey behind your back. Just roll on your side for me. That's it. Okay. The bluey is basically just here to protect your clothing and that. Well, it's one of our hospital gowns, but it's just there in case we get any leakage. Okay. There is about 1,530 mils of liquid in the drain, and we'll just turn this suction off. Okay, let's get you ready. Dressing trolley. Scott, are you comfortable there?
Yeah.
Okay, are you happy if we continue?
Yes.
So the first thing that we're going to do is we're going to take the oil dressing down, and then we'll go go and do our clinical hand wash and put our sterile gloves on. Okay? If you've got any questions at this stage, please don't hesitate to ask. So just a bit cold, I've just got some remove wipe to go over the top. Alright, so Kim and I will go do our sterile wash now. When we come back, again we'll clean around with some saline. There's a stitch that needs to be removed, and then we shall take the drain out. Okay, take it in a minute. Okay, Scott, are you happy if we continue?
Yes.
Okay, so I'm just going to clean around the site with some saline first up. It'll be a bit cold,
Okay.
and then we'll dry it off. Alrighty, Scott. We're going to practice that breathing technique that I was talking about before. Okay?
Yeah.
So first thing I want you to do, can you breathe in for me? And breathe out. Then breathe in. Breathe out. Take a really deep breath in, and then hold it. Now while you're holding your breath, I'm going to cut the suture, take the tube out. Kim's going to put the Steri-Strips and the dressing on over the top, and once that's completed, I'll then say breathe normally, and you can breathe normally.
Yeah.
Okay? Now the length of time that you've just held your breath for is about the length of time that the whole process should take. Okay? Have you got any questions? No? Okay. So I'll just give this a quick dry off. Okay, you ready? Alright. Kim, I'm going to pass over to you the dressing with Steri-Strips. I'll just pop them on our little sheet there. Put a Steri-Strip and your dressing. Okay, you ready? Okay. So, Scott, breathe in for me and breathe out. Breathe in, breathe out. Take a deep breath in and hold it. Okay, just cutting the suture now. Removing the chest drain and pinching. Just once more. Got there in hand. Okay. How was that, Scott?
That was fine.
No problems? Okay.
Yes, right.
So from here on in, the girls or the nursing staff will come and they will do your OBS every half hour for the next 2 hours. Can you please let us know if you feel any shortness of breath, if you get any pain at all, any of those sorts of things that you might have felt originally when you first had your pneumothorax. Okay?
Yeah.
Any questions for me?
No, not at the moment.
Okay, Scott, thank you.
Thank you.
Hi Scott, my name's Darren, and this is Kim, my assistant.
Thanks, Scott.
We have spoken with your doctors and they've asked us to come and take out your chest drain. Now most people say that when we're taking the drain out and pinching, that's what causes most of the pain because I'm actually pinching your skin. But what that does is it helps us to prevent air from going.
So let's go through this step by step. Make sure that you've discussed with your partner the roles that you'll both be playing. Then talk with your patient, let them know what to expect, what you'll be doing, and the role of the assistant. Also let them know that you'll need to pinch their skin during the removal process and why you're doing it. Then determine if they need any pain relief.
Not at the moment, no.
Oh, okay. I might get you to roll onto your side for me. I've got a bluey here, and we pop the blue behind your back. Just roll around this side. Okay. The blue is basically just here to protect your clothing and that. It's one of our hospital gowns, but it's just there in case we get any leakage. Okay. There is about 15. Next, position your patient so they're lying on the opposite side to the drain side and place the blue undersheet beside them on the bed. Set your patient up, ensuring you have access to the chest drain insertion site, and check the drainage volume and ensure that suction is disconnected. Scott, are you comfortable there?
Yeah.
Okay, are you happy if we continue?
Yes.
Just a bit cold, I've just got some remove wipe to go at the top. Then clean your hands, set up your dressing trolley with all the required equipment. Once you've cleaned your hands again, apply your non-sterile gloves and remove the oil dressing using remove wipes. And then both you and your partner perform a clinical hand wash and apply your sterile gloves. Alrighty, Scott. We're going to practice that breathing technique that I was talking about before. Okay?
Yeah.
So first thing I want you to do, can you breathe in for me? And breathe out. Then breathe in, breathe out. Take a really deep breath in, and then hold it. Now while you're holding your breath, I'm going to cut the suture, take the tube out. Kim's going to put the Steri-Strips and the dressing on over the top, and once that's completed, I'll then say breathe normally, and you can breathe normally.
Yeah.
Okay? Now the length of time that you've just held your breath for is about the length of time that the whole process should take. Okay? Have you got any questions? No? Okay. So I'll just give this a quick dry off. Clean around the insertion site using saline soaked gauze in a spiral manner, starting from the insertion site and working outwards. Repeat this twice. Then dry around the site. Once you've done this, practice the breathing technique with the patient, getting them to hold their breath. Whilst they're holding their breath, describe what your next steps are going to be. When you've finished your description, remember to ask them to breathe normally again. The length of time that they've held their breath for is approximately the length of time that they will need to hold their breath for during the removal process. Then ask your patients if they are happy for you to proceed. When you're finished cleaning the area, ensure that your assistant has access to the Steri-Strips and dressing that they'll need once you've completed the drain removal. Then, position the fingers of your non-dominant hand as wide as you can near the drain insertion site and ask the patient to perform the breathing technique, holding their breath. Once they reach peak inspiration and are holding their breath, cut the suture and remove the chest drain using a brisk but firm technique. The drain should be removed in one smooth motion, pinching the patient's skin. The assistant nurse then applies the Steri-Strips and dressing. Don't be concerned if your fingers are caught up in the Steri-Strips, they will release when the dressing's applied. How was that, Scott?
That was fine.
No problems? Okay.
So,
As well as checking on your patient after removing the drain, please ask them to notify the nursing staff if they experience any pain, shortness of breath, or ooze from the insertion site. Monitor the patient's vital signs every 30 minutes for the first 2 hours, and then return to the standard ward observations if their vital signs are stable. Please notify the treating team of any complications with the drain removal as soon as possible. Dispose of any clinical waste in the clinical waste bins. If the chamber is to be sent to pathology, please ensure that it is clamped to prevent fluid leakage and labelled with the patient's details. Package it in a clinical waste bag, the yellow bags, and contact the wards people to take it across to pathology. Document the procedure in the patient's chart, and then the patient will usually have a chest x-ray between 2 and 4 hours post-drain removal. Complications that may occur post-drain removal include bleeding, infection at the insertion site, pneumothorax, and subcutaneous emphysema. That's a collection of air in the tissues just under the skin. If complications do occur, again, please notify the treating team immediately. If you have any questions about this process, please contact the thoracic ward clinical nurse teachers on extension 5283.